Hello, my name is Rainisha. Today I'm going to be doing a full body assessment. So before I begin my video, can I start with your age and date of birth, please?
39 years old. Date of birth is December 22nd, 1986.
All right, do you consent to this video?
Yes.
All right. So before I get started, I'm going to provide my patient with privacy. I'm going to perform my hand hygiene here. All right. So I'm going to come into my client's room. All right, hello, my name is Rainisha. I'm your student nurse today. I'll be doing a full body assessment on you. Can I start with your full name and your date of birth, please?
Darnell Pratt, 12/22/1986.
All right, okay, Darnell Pratt. How are you feeling today, Darnell?
Good.
All right, do you have any pain on a scale of 0 to 10, 10 being the worst pain you've ever had?
No.
All right, do you have any allergies?
No.
All right, can you tell me where you are today?
Syracuse, New York.
All right,
Inside the living room
can you tell me why you're here?
for a full body assessment.
All right, can you tell me what you had for breakfast this morning?
Cereal.
All right, can you tell me where you were born?
Camden, New Jersey.
All right, so patient remote and recent memory are intact. Patient is alert and oriented ×3. The person, place, time. It's a person in place and time. Patient mood and affect are appropriate for today's assessment. Patient also is dressed appropriately. Hygiene looks well kept. He's groomed well, good. His posture is upright. So now I'm going to begin, okay? And now I'm going to start. Now I'm going to perform hand hygiene. My gloves on here. Okay, Mr. Pratt, can you do me a favor? And can you, I'm gonna assess your cranial nerve 1. Can you occlude one nostril for me, please, and close your eyes? Can you tell me what you smell?
Hand sanitizer.
All right. Can you close the other nostril for me, please? Can you tell me what you smell?
Smells like gum.
Okay. So patient cranial nerve 1 is intact bilaterally. So now for cranial nerve 2, if I had a Snellen chart, I would have my client stand in front of the Snellen chart and read the lowest font that he can read on the chart. So for cranial nerve 3, 4, and 6. Okay, you can open your eyes now, Mr. Pratt. Okay. Can you look straight ahead for me at the TV, please? Follow my pen, which is your eye. All right. All right. All right, so patient, okay. So patient eyes are equal bilaterally. They are, pupils are equal, react to light and accommodation. Round equal and react to light and accommodation. So now I'm going to check. All right, can you just follow my pen with just your eyes, please? I know it's kind of bright. Sorry about that. Don't use your head. All right, so cranial nerves 3, 4, and 6 are intact. Client eyes, pupils react to, client pupils are equal. They react to light and accommodation. So now I'm going to move on to cranial nerve number 5. Can you clench can you clench your teeth for me, please? All right, so I'm going to check your answer. All right, that's intact laterally. All right, so now I need you to close your eyes and tell me if you feel sharpness or dullness, okay?
Dullness.
Okay.
Sharpness.
All right.
Dull. Dull.
All right, so cranial nerve 5 is intact. Facial sensation is there. All right. So now I'm gonna move on to cranial nerve number 7. So cranial nerve number 7, I need for you, can you please smile for me, frown for me, raise your eyebrows. All right, puff out your cheeks. All right, so, okay, you can let go. Cranial nerve 7 is intact, no facial drooping noted. All right, so for cranial nerve number 8, I am gonna come back here. I need for you to please occlude one ear, please. All right, I'm gonna whisper something. Can you tell me what you hear?
1, 2, 3.
All right, can you close the other ear, please?
4, 5, 6.
All right, so cranial nerve number 8 is intact. Hearing, no hard of hearing. All right, so now I'm gonna move on to cranial number 9. If I had a tongue depressor, I would use a tongue depressor and check the gag reflex. So now for cranial number 10, I'm gonna ask my client to please, can you please open your mouth and stick out your tongue? All right, hold on. All right, so cranial nerve number 10, the uvula rises midline and remains midline, no deviations noted. So for cranial nerve number 12, the tongue, when he gets to open his mouth, can you say ah?
Ah.
All right, so for cranial nerve number 12, the tongue protrudes midline with no deviations, remains midline. So for cranial nerve number 11, can you move, lean forward for me, please? All right, I'm gonna push against your shoulders. You try to resist myself. Okay. You understand? Can you turn your head this way? Yeah. And this way. All right. Cranial nerve number 11 is intact. All right. So now I am going to move on to the skin, inspect my client's skin. So on general appearance, the skin is matches my client's ethnicity. I see no open wounds or lesions or lumps, bumps, or humps. I see a couple of tattoos, but no scarring or no open infections or anything. They heal pretty well. So now I am going to palpate bilaterally. All right. So my client's skin is warm, dry, clean, and intact. No lumps, bumps, or masses noted. No open lacerations. So now I am going to palpate my client's radial pulse bilaterally. I got a 2+ here. All right, so now I am on to check my client's bony prominences. Can I see your elbow, please? Your other elbow. Your knees. Okay, I'm sorry, I gotta take your socks off here. The heel. Other heel. All right. So my client bony prominences, I see no open wounds, no holes, no any leakage or anything. So it's intact, it's dry. All right. So now I'm going to move on. Check my patient's skin trooper here. Return 2+. So no tinting noted. I'm going to perform cap refill. That's a 2+ on the right hand. 2+ on the left hand. Skin trooper is even bilaterally. No tinting noted here. So now I am going to assess my client's head on general appearance. I see no lumps, bumps, or any masses. I see an even amount of hair distributed, no signs of alopecia here. Now on palpation, any pain or tenderness?
No.
No pain or tenderness. I feel no lumps, masses, or bumps on palpation. Alright. So now I'm going to move on to my client's ears. I'm going to inspect. Okay. I see on general appearance, the looks warm, clean, warm, dry, and intact. No drainage, cerumen or anything coming from the ears. Now I am going to palpate the tragus and the oracles. Alright, any pain or tenderness?
No.
Any pain or tenderness?
No.
Alright, the patient's ears are equal bilaterally, no pain and tenderness. I'll check the master has no equal bilaterally. I feel no lumps or bumps, no pain or tenderness.
No.
Alright. So now I am going to can you hold your head up for me, please? I am going to check my client's frontal sinuses here. Any pain or tenderness?
No.
Alright, no pain or tenderness, noted. Alright, I'm going to check my client's maxillary sinuses here. Any pain or tenderness?
No.
Alright. Now moving on to my client's eyes. Can you open your eyes, please? Alright, I've already checked the pupils are equal round and react to light in accommodation with the cranial nerve 3, 4, and 6. Can you open your eyes, please? Can you look up? Alright, the client's sclera is white, no signs of drainage. I'm gonna pull this down. Sorry. Alright, the conjunctival sac is pink. Same on this side. Sclera is white, conjunctival sac is pink and moist. No drainage noted, no jaundice noted. Also no crust or any infestations around the eyes. So now I'm going to move on to my client's nose. So the nose sits midline. No deviations noted. The skin is clean, dry, and intact around the nose. No scars or bruising. Okay, so can you look up a little bit for me, please? Now I'm going to inspect the nasal mucosa, which is pink. I see no drainage. No signs of infection. Alright, I'm going to palpate. Okay, any
Yes.
tenderness?
No.
Alright, my client's nose is intact bilaterally. Can I ask you to, nasals are intact bilaterally. Can I ask you to occlude one there for me, please? And breathe in. Alright, do the same for the other, please. Breathe in. Alright, my client's nasal patency is evenly distributed. It's equal bilaterally. So now I'm going to move on to my client's mouth. So for the mouth, around the mouth, the color is good to this, matches my client's ethnicity, his skin color. So I see no signs of cyanosis or dry chapped lips. I'm also gonna ask for my client to open his mouth. I'm gonna look inside. Okay, so my client has 34 good teeth, white teeth, no broken cavities, chips, or signs of gingivitis. The buccal mucosa is pink, moist, no signs of infection or gingivitis or a smell. All right. Okay, I'm gonna move on now to my clients. Okay, can you stand for me? All right, can you turn around? All right, now I'm going to check my client's CBA here. Can you take a deep breath in for me? Exhale. All right. Client's chest expansion is normal. Chest is no barrel chest. No barrel chest. Client is 1 to 2. All right. Now I'm going to listen to my client's lung sounds posteriorly. All right, each time can you take a deep breath in and a deep breath out for me, please? Ready? In. 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 Again. All right. No rubs, no sounds of wheezes going on here. Client's chest sounds, breath sounds normal. Turn around to the front for me, please. I'm gonna also listen to my client's lung sounds anteriorly. Breathe in. Again. Again. All right, lung sound clear, no rubbing, no wheezes, no bronchi. So now I am going to listen to my client's heart sounds. You could just breathe normal for me. So the aortic here within the aortic here, Erb's point here, second left intercostal. The Erbs. Tricuspid. Mitral. All right, I hear no sounds of murmurs. I will also use the bell of my stethoscope and listen to those same sounds for murmurs. All right, you can have a seat now. Okay, now I am going to assess my client's upper extremities. So they are warm, dry, and intact here. I am going to palpate bilaterally my client's brachial bilaterally. 2+ bilaterally, a regular pulse, no threadiness, no bounding. Alright? So now I'm going to have my client I will assess my client's muscle mass here. Can you on his upper extremities? Can you stand back up? I'm sorry. Alright, can you take your arms and spin and up for me? Alright, can you bring them down? Add up. Alright. Alright, can you move it out? Alright. Hyper stiff. All the way back. Alright. Can you circumduction for me? Okay, that's good. Okay. Client's strength is a 5 out of 5. No signs of any type of any crepitus. Alright, can you put your arms out? Don't let me push. Don't let me pull. Alright, muscle mass a 5 out of 5 here. Okay. Now I am going to have my client, forgot to ask you about this over here, your CBA. Can you tell me if you feel any pain or tenderness when I do this?
No.
Alright.
No.
Alright, no signs of CBAs. Okay. Okay, now you can sit down for me. Alright, can you, alright, sir, can you lay, please? You know what? The other way, not prone. Alright. Now I'm going to ask you to raise your shirt up, please. Alright, so now I'm assessing my client's abdomen. Now on an assessment, the client's abdomen is non-distended, looks evenly distributed, no forms of deformities. The skin looks clean, dry, and intact. No signs of lumps, humps, or bumps. Alright, so now can you tell me when your last bowel movement was?
This morning, about 8:30.
Is that normal for you? Do you have a bowel movement every day?
Yes.
Alright. Can you tell me, is it, on urination, is it hard for urination?
No.
Alright. So, have you had any diarrhea lately?
No.
Alright, so now I am going to auscultate all 4 quadrants. Start to bring it lower. Upper. Left upper. Lower. Alright. So now I'm going to do gentle. Bowel sounds are normal active, no hyperactivity. Now I'm going to gently palpate. Tell me if you feel any pain or tenderness, okay?
Yes.
Any pain or tenderness?
No.
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 Alright, now I'm going to deep palpate. Same thing. Let me know if you feel any pain or tenderness, okay? Any pain or tenderness?
No.
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 Alright. So my client's abdomen is intact, no pain or tenderness, no feeling, no masses, no bumps or anything protruding out, no masses or anything. Alright, so you can sit up now, please. Alright, now I'm going to assess my client's lower extremities here. So on general appearance, the client has The skin is clean, dry, and intact. No signs of bruising or anything. The hair is fully distributed throughout. Now I am going to palpate bilaterally. So no signs of irresities or lumps, humps, or bumps. All right. Now can you sit your foot straight up? No, yeah, both of them. Okay. So now I am going to palpate my client's dorsalis pedis for the dorsalis pedis pulse is 2+ bilaterally, no bounding, thready, it's normal. Now I'm going to go down and check my client's cap refill bilaterally. 2+, so no clients, no signs of cyanosis. Clients blood flow returns right back to normal. All right, now I'm going to check the anterior tibialis. 2+, no bounding, no dirtiness, it's normal. Alright, so now can you dorsiflex, lift up your foot, yep. Plantar flex, same here. Plantar, alright. Muscle strength is a 5 out of 5 here, full range of motion. Alright, can you raise your knee or let me push? Alright, same with the left. Alright, client's muscle strength is a 5 out of 5, both legs. Alright, now I'm going to give you a light chop here to the reflexes. Alright, client has DTR here, normal. Alright, so now can you stand up for me, please? Can you take a walk straight that way? Just walk normal. All right, walk back. All right, turn around, please. Now, I need you to go walk heel to toe for me, please. Yep. Yep. Same. All right. So client is gait is balanced and steady. No signs of unsteadiness here. So while you're here, can you turn your body to the left? Yep. Now to the right. All right. Now back for me. Forward. All right. Client posture is good. No signs of kyphosis or lordosis, scoliosis. The spine is upright, straight posture. You can stand straight for me now. I forgot. Okay. I forgot to palpate my client's carotid singly. So palpate here. Carotid pulses is a 2+. Other side. And then I would then take the bell and listen for any bruit. All right, no bruit noted here. Okay, so now I'm going to perform a Rombox test. I just need for you to stand still, close your eyes for me. All right. Client's Rombox is positive, excuse me. Client's gait is steady. upright posture. All right, you can open your eyes, sir. You can have a seat for me, please. I'm gonna go back through. Client's neck, his trachea is midline, no deviations noted to the left or the right. All right, so do you have any further questions for me?
No, ma'am.
All right, so now I will take my gloves off. I will perform hand hygiene. Do you need anything before I leave your room?
No, ma'am.
All right, I'm gonna lock your bed. Put your bed down to the lowest position. Make sure your call bell is in reach. Then I will make sure I chart my findings and how my patient responded to the procedure, and that's it. Over.